Welcome to Sonogrip. Today, we are scanning the subcutaneous lipoma, a 36 years old female lady who has soft, mobile, and non-tender mass located at interior abdominal wall, subcutaneous tissues of right lumbar region, which is common spot for patient to notice. Let's see how it looks under the probe. Using our high-frequency probe, we identify the mass within subcutaneous fat layer. It is hyperechoic to the surrounding fat and capsule-like borders. Notice its shape. It is elongated and sits horizontally to the skin surface. This wider than taller orientation is a simple sign of benign lipoma. We can also see that this lesion has no extension into the deep tissues and it sits safely in the superficial fat separate from muscular layer. Let's apply color Doppler as we see an absolute absence of internal and peripheral vascularity, which confirms that there is no active inflammatory or aggressive process. Let's summarize what we report for this case. The clinically palpable swelling show well-defined echogenic oval-shaped homogeneous lesion in subcutaneous tissues. No extension into the deep tissue seen. Color Doppler shows no internal vascularity. And at last for impression, subcutaneous lipoma. Thanks for watching. Please like and subscribe to Sonogrip for more videos.